Standing by in the K-Wave News Zoom room, he's the chair of the Physicians Advisor Group, and we know there was a big meeting last night, right, Doc?
Yeah, it's we are we're not doing very good. I think that the whole island, everyone again need to be very responsible. Now, if you think the rate we go right now, in about 3-4 weeks or so, we will hit 5,000 positive in Guam. You and the hospital, both of them, GMH and GMC, uh, are really running out of room. I tell you, when you start coding the patient outside the emergency room on the street, that those pictures should be somewhere else and not in Guam, but it is in Guam. Really, everything that we can do at this point, the lockdown, everything else so far, it need everyone to be the front line. But in the past week to 2 weeks or so, we see an increase in positive rate in several occasions that we do not like to see. There's quite a few positive rate come out the funeral. If you go to a funeral, there's supposed to be a limited number of people. Quite a few people come out positive. I think at least 6 or 8 people already from one funeral, and some of them end up in the hospital. There's birthday party, that people still have birthday party, multiple family, and now multiple people from different family are sick. We have wedding. I'm not quite sure. If we really want to go back to somewhat a controlled setting in the next few months, if people don't respect each other and don't care about their family, if you keep doing this thing with the funeral and the birthday party and the wedding, we will go through the holiday in a much worse situation. So I'm just really, from the Physician Advisory Group, we just really ask everyone to really abide by the social distance, stay within your family, wear your mask, and really be safe. We have 78, I think more now, in the hospital. And the number, I think that several people projected to reach 100 in the next few weeks in the hospital. So I'm telling you, we are not Hawaii, we're not the state, we are in Guam, and the healthcare system are very fragile at this point. So if people don't respect each other and don't care to curb this thing, we're going to hit 5,000 very soon, a lot sooner than in about 3 to 4 weeks. So, again, stay with your family, and if your family is sick, stay at home. Don't go to work, because you're going to bring this into work, and it's going to be all over again. Again, everyone need to understand this virus here have 2 weeks of lifespan. If it stay in your body for 2 weeks and they have nowhere else to go to the next person, it will go away. So 2 weeks is not that long for everyone to keep to themselves, so we can curb this thing. But if you keep saying when you turn positive, I didn't think it's going to happen to me. Well, it happened. Now your whole family at risk. So just 2 weeks for this virus to go away. So it's not too hard to ask everyone in Guam to abide by that rule. So, the governor can put more restriction to the whole island, but it doesn't work if the family still gather within the compound and spread the virus within the family. So I think that restriction, everything else, curfew, or everything else won't work unless the people follow the rule. So I just ask everyone to follow the 2 weeks of keep it to yourself if possible. So, like I say, there's a picture going on the media. I'm not sure anyone see it yet, but when you are holding patient outside emergency room, it's not a good thing because there's totally full inside.
So can you send us the
I
picture?
feel, I feel like those pictures you should see in the state, not in Guam, not in your home.
Yeah.
Just to follow up on
that-
what you were saying with the funerals and the weddings, and that's where you're seeing a lot of the, I guess, where the main infection points. So was there discussions last night that there were going to be recommendations to implement stricter restrictions for the funerals and weddings?
Right. Because now I think it's at 25, right? That's what the
You
public
know,
health guidance says.
Yeah,
I'm
I've
not
been
mistaken.
so busy in the last week or so. I tell you, clinic can get warm so bad with sick patient that I didn't have a chance to attend the government meeting in the morning. But I tell you, funeral, we have a restriction. It's already in line. It's already in the executive order. But so the family need to kind of respect that because again, you like to pay respect for someone that passed away, but at the same time, you don't want to be your funeral neither. And that's something that you take a risk when you do that. So pay respect in a different way. Like I said, if in the family, immediate family, just keep the distance and do that. But when you have 20, 30 people in one place, you're going to get infected. And that's the chance is very high when the positivity rate is so high, So it's really crazy. So you just have to pay attention and do something else different. But again, as we open up more, you just have to, I tell you, you got to be disciplined. And birthday, I don't know. We still have tons of people that plan for birthday party.
So what is in the discussions last night amongst the physicians advisory group, what will you guys be recommending to the governor with respect to these funerals and weddings?
Last night we really talked about more on how to augment public health, Sabrina, because right now I'm not sure any further restriction we can do to do that because we just need people to be compliant, But things we can do is augment public health from the manual paperwork that they do to digitalize the process they went through. For manual thing, it takes 2-3 hours to do one person. With digitalize, use computer and use technology, you can cut that thing in about 5 to 10 minutes. And as we go forward to this thing, we really have to move to 2020 and not get stuck in 1980 technology. And this virus here they stay up 24 hours a day. It doesn't work from 8 to 6 or 8 to 8 or whatever. So we really need to step up and challenge the public health system and really work 24 hours a day to combat this, to do contact tracing. This is where the most important thing for us to move forward. We can learn to live with this virus only when it's under control.
Yeah.
We cannot learn to live with this virus when it's out of control. We got to control it first. So for the people out there say we learn to live with the virus, control it first, then we learn. But when it's like this, we cannot learn. We have to control it first.
So we need more technology because we already got the Emoco, we got the Sarah Alert, we got the COVID Alert app, and public health. I mean, they're burning out over there. So what kind of technology are we talking about?
Yeah, Sabrina, you got to work smarter rather than harder. You have team, four team there that if they do all manual work and then one team don't know what the other team does, it's very hard to do. Just like in the clinic now, most clinics have EMR, electronic medical record. I can see what the process is. Even I sit at home, I can see everything at home by just signing in the computer. I know exactly what my staff does. I know exactly who spent on the phone, how long spent on the phone. Those are stuff that will help you to kind of control this virus. I need to know if you have 100 positive today, how many of those 100 positive that you're going to contact the same day in order to isolate them, and do the contact tracing. Those are number that I can put on the finger and just push a button. Those should be available for you, and not have to chase after it. Those are technology platform that we can use, and rather than just use strictly on the paperwork thing. And we have to move out of it because this is a marathon. This is not just a sprint really quick. We're going to talk about until we get the vaccine. We're going to talk about another few months, a year or so. So we got to kind of change the way we approach and control this thing. If not, we are a few months back already. We can't turn the clock back, but we need to go forward and use technology to our advantage. We need to do something else. We look at some platform that already exists. And we're going to try to push that to the next level so public health can try to get on board to try to control this thing. But everyone needs help. They need help. Like I said, everyone now is not surprised that they're overwhelmed, which they are. Like I said, you got to learn to work smarter than harder. So that's the thing.
Right.
So that's what we've been talking about. So we have to learn a different way.
Did you guys have any reaction to what happened at the Guam Visitors Bureau meeting yesterday when the GVB Deputy General Manager said that the current test and tracing strategy for containing COVID is not making any significant impact?
And Jerry's is correct. And I tell you, that's a correct statement. That's why we have to move forward in a different way to do this thing. We got to increase our testing capacity. We got to increase the use of technology to our advantage. That's something we have to go forward. And what we do right now regarding testing and contact tracing is not working. So we like I say, when you do all the manual stuff, it's really very inefficient. You got to all the technologies out there. We got to invest money in there, and we got to move forward. Because, like I say, it's not going to be just over by next week, next month. This thing might last till next year. So we really have to invest in this digital technology and try to control this thing. I tell you, we have no choice. We got to fight this thing 24 hours a day rather than half a day. It's not going to work.
Do you have any idea how much how much money we're talking to digitize whatever it is you're talking about?
Sabrina, I don't know how much it costs. I know we have CARE Act money there, and at a certain point, you have to bite the bullet now. Way is too late, and we do crisis management.
Oh, I thought we were doing crisis management right now.
We are crisis management. And it's not good because we're going to get really tight soon. I tell you, the healthcare provider, the clinic, and the hospital, we are tired. It's very hard to see unlimited sick patient. We like to see patient in a different reason why they hear. But when they hear they can't breathe or they cough, We got really tired, So
Mm.
I feel for both GMH and GRMC,
Yeah.
Well,
and really
yeah,
So
appreciate that.
it's clear their GMH is 64 patients. At least that was as of last night. So when you hear that there are how many 11 at GRMC,
GRMC,
right? So GMH must be just full. Is it just
they
they
are
can't
full.
take any more? Are we gonna when are we gonna start seeing these tents go up? Are we that close to seeing them go up?
We Yeah, we're that close because like I say, when you start, coding patient outside your ER, you are full. So those 10 will need to come up and come up soon because I say we're going to hit the 100 soon. You know, I think everyone say the same thing. I think even Dr. David's a new person coming out. She's gonna say the same thing. We're gonna hit 100 soon.
yeah. So what are we
So
going to do different, Doc? I mean, clearly all of this isn't working. That's none of it's working. So we're going to keep banging our head against the wall and expecting something different to happen, or are you guys recommending any tightening of restrictions? Maybe the governor needs to say, hey, no more gatherings of 5 because I give you guys an inch, you take a mile, and people are dying. So are we just going
Yeah.
to keep doing the same thing? Or are we going to ask the governor to change something? Or
Are we gonna ask the military for advice?
the things like this, right? Doesn't matter, like I say, doesn't matter what we put restriction in there. It's boiled down to one thing, right? You guys know, it's our people, and that's what it is. Is it boiled down to one thing? It's our people. We just need to. Everyone is responsible for this. Everybody. Responsible for it. So we have, again, we saw a little bit of increase in the pediatric population. I'm sure Dr. Mike will tell you that. And your children cannot get it unless you give it to them. So it's all the responsibility lay on everybody in Guam. So we have to work together and stop asking for more restriction, because doesn't matter what restriction we put on you, if you don't take responsible individually, the restriction is no good. So that's the thing I want to really stretch, is that nobody like to put restriction. We just ask for you to be responsible. That's all we're asking for. And again, I want to throw this into one out. If anyone out there that believe in herd immunity, okay, I know a few people out there that believe in that. It's very easy. You always do things lead by example. If you want herd immunity, I would tell you, whoever those people are, go to GMH. Don't get your PPE, get infected, okay, and so you be immune. And so that way you can lead and speak with your voice. But those people are kind of irresponsible when they say that to the public, because they are protecting themselves in their house. So please don't say that, because we are all vulnerable to this virus. And again, this is not a common flu. It's much more infectious and much more deadly. So like I say, we just need people to understand that and help each other and protect themselves and their family. So Chris Sabrina, it's not a restriction, it's not the limitation, it's the people that are responsible for it, okay? So we want to go see the movie, we want to go eat in a restaurant, we want to go shopping. So in order for us to do that, we need everybody's help. So the message is responsibility, okay?
okay. Bree, anything else?
No.
So,
Well, I have.
oh,
something.
Jason has something.
Yeah, well, Doug, just to supplement, you were saying, we need to get better through the use of technology and to apply these tools. The free app, the Guam COVID Alert app. I had messaged our friends at Public Health while you were talking, and they said again their goal is they want to get 75,000 downloads, which would be roughly about 2/3 of our island's population, for it to be truly effective, because you have this network effect of the more people that run the app, the stronger the app gets. And they said right now, it's been about maybe a month and a half since this app has been developed and everything. They're at 19,000 downloads, which is only about 26% of the stated goal of 75,000 downloads. So people, please, we need to download this thing. It's absolutely free. It's nobody spying on you. It's not going to kill your battery. It's, again, there's only upsides to this. So,
I haven't got it. I got the app. All the time. I haven't had anybody positive.
That's astonishing to me.
all
Like
these
it's
positives
been a
around
month and a
here.
half. There's only
Yeah.
19,000 downloads.
Yeah.
Yeah, there's a challenge out there. I tell you, Gulf Farm have the largest employee of them all, right? 10,000 or something. It's only
More than that.
400 of them are download. That's a challenge for Gulf Farm employee. Download the app. You are the largest workforce in Guam, and you absolutely didn't follow the recommendation. Okay, I would challenge the Gulf Farm employee, download the app. That's 10,000 of them.
I wonder if Gulf Guam could actually
So
mandate it and make that a requirement of anybody that works in public service, that they say you have to run this.
Doc,
So,
can I?
That's the frustration. So Gulf Farm employee, we challenge you to download the app. Push a button. It's not that hard to do. And just like Jason say, there's no privacy in there. No one know who you are. So download the app to help mitigate this virus. Okay?
All right, Doc, I wanted to follow up on something. I wanted to go back to the hospitalizations and us nearing the point where we're may have to put up tents for more COVID patients. But what about, were there any discussions on getting more medical professionals on Guam? I remember when we had the FEMA deployment for the military personnel coming to Guam to help for that 30 days. What are we going to do?
I think there's a whole lot of more critical RN coming in from critical care unit. So I think that GMH bringing like another 30. So we do have some reinforcement for the nursing staff. We just need to look for a physician, the critical care physician, to make sure that to give Dr. Jolene Agon a break. I tell you, if anything else, that's the most hardest working physician in Guam. And like I said, we need to give her a break somehow. And my question is, if something happened to her, who take over? And everyone have a blank look. So I tell you, you got to somehow recruit some critical care physician to come in and take care of Dr. Agon. That's
right.
It's very important. She's the only one. So
All right.
So have you heard if there's been any recruitment efforts then? Are they part of this whole staffing solution agencies that the GMH is using? But you're right, on the 22nd, there was supposed to be a contingent of critical care nurses that that were supposed to arrive on Guam. And then a few more, I think, on the 29th.
Yeah, that question we ask all the time. We don't have an answer. So I hope they are working on it rather than wait something happen and then and start do the crisis management again. But no, we're gonna keep pushing that question, Sabrina.
So basically, we're on our own right now. We're not changing anything. No change in posture. No canceling outdoor dining. No canceling the gatherings. Just keep on being responsible individuals, because look where it's getting us. Getting us to a really good place.
Keep on being responsible.
That was sarcasm.
Yeah, just be responsible. I don't know if anything else new coming out, but I guess we'll find out today. But from right now, I don't think we should open anything else up.
Yeah.
The case going up so. I'm gonna say good luck to Dodia, but let's see what happens at school. But
Thanks for the reminder.
Well,
be responsible, and let's move forward together. Okay.
What is that vector? What was?
Are you the vector or the
Oh,
victim?
don't be the something. No.
You are the vector, not the victim, is what it is.
Yeah.
Yeah.
But don't be the vector neither. Okay.
No, the governor said we're the vector. So that's it.
The youth.
We got the COVID cooties.
Don't be the host. Okay. Okay, guys. I gotta go, patient. Okay.
All right. Thanks.
Thanks,
Rob.
Doc.
Stay safe.
Take care, guys.
Get your flu shot, everybody.
Bye-bye.
Okay, see you.
Okay. Bye.
Bye.
You know, I'm just looking at the numbers of from Wednesday to Thursday, right, and where you're seeing the increase in the age demographics. So, from 20 to 29 years old, 26. That's the largest group.
Yeah.
Followed by 30 to 39 and 50 to 59, 14 new infections in both age demographics.
Oh, there you go. I'm not really having the best morning. I came in here like, hey, it's Friday, and then we had public health on, and they're like, man, it's bad. Public health is working so hard. They got so many haters on their back. It's frustrating. And then we get Dr. Ho on, who's like, yes, it's very serious. Oh, it's so serious. Oh, man, we got to do better. We got to do better. But we're just going to keep doing the same thing. So.
You know, I was thinking of something.
Yeah,
again.
Jay.
I was thinking about something he said, and the thing about, you know, he's pleading in earnest with GovGuam employees to, you know, run the app as public servants and everything. It would be, I would think, very easy to get the private sector to basically do it, because like at our company, you know, we're furnished with cell phones that we use for work, and our airtime and our data plans are taken care of. So they could very easily just say, okay, it's mandatory for every KUM staffer to run the app. And you would think that that could also be applied to private sector, nonprofits, government, the feds certainly.
Yeah.
But just in terms of like getting that out, I mean, yeah, I tend to lean a little bit more towards that kind of thing because it's app marketing, you know, which is like the only thing that I know. But I mean, just actually getting this thing deployed to the widest number of users out there and just running it is, you know, I mean, it's a challenge, but it's not impossible. So when he said that, he's like, you know, please GovCom employees, please, you know, please run it. You know, that's a huge amount of the number of people here. You know, if any directors are listening and everything like that, you know, maybe just put something out. And
Thanks, Jay. Let's go to the KUM News Zoom room where we have standing by. We have Tatuha Mayor Luis Rivera and Sinania Mayor Robert Hoffman. We'll go to Mayor Hoffman. We all got Maria Pangolina and GC coming up as well, and we got our friends of Salvation Army to talk about Toys for Tots.